To compare and study intraocular pressure measurement by non-contact tonometer and contact tonometer, that is Goldmann applanation tonometer and Short's tonometer, and their correlation with central corneal thickness. Introduction. Measurement of intraocular pressure is one of the basic investigations in a general ophthalmic workup. Accurate and precise measurement of IOP is therefore fundamental to management of glaucoma. Detecting IOP is essential not only in initiating treatment but also in monitoring treatment. Central corneal thickness is known to affect the accuracy of the intraocular pressure measurements. A thicker cornea requires greater force to applanate, and conversely, a thinner cornea is required more easily inflated. Flat. Aims and objectives. To compare intraocular pressure measurement with non-contact tonometry and Goldmann tonometry, and to compare NCT IOP, Goldmann ablation tonometry IOP, and Short's IOP among various central corneal thickness groups. Objectives. To know the influence of central corneal thickness on IOP measurements, to study and evaluate the accuracy in IOP measurement done by contact tonometer, Goldmann applanation tonometer, Short's tonometer, and non-contact tonometer. Methods and materials. It is an observational and comparative study. All the patients coming to the ophthalmic OPD at ABBRH will be selected for the study after taking inclusion and exclusion criteria into considerations. Sample size is 120. IOP measurement were done by NCT, then by Goldmann applanation tonometer, followed by Short's tonometer, then followed by central corneal thickness. Inclusion criteria: age above 30 years, IOP within 10 to 15 millimeters of mercury measured by non-contact astigmatism less than or equal to 3 diopters of silver. Exclusion criteria: previous history of ocular surgery. Patients with significant corneal astigmatism, 3 diopters, are excluded so as to eliminate the requirement for alteration of the orientation of the tonometer prism from the convention of the horizontal meridian. Physical difficulty in performing applanation. Pathology of the cornea that would affect biomechanics and thus the size and appearance of the tear meniscus semicircles, that is keratoconus, corneal scarring, previous corneal surgery, corneal infection, microphthalmos, bophthalmos, and blepharospasm. Patients diagnosed with glaucoma. Results: the mean age is 63.74. The age distribution lies between 41 to 80 years. Females is of 56% and the males are of 44. The correlation of central corneal thickness with non-contact tonometer. Mean central corneal thickness is 530.66. The mean non-contact tonometer reading is 14.49. Now the correlation of central corneal thickness with Goldmann applanation tonometer. Mean Goldmann applanation tonometer reading is 14.15. The correlation of central corneal thickness with Short's tonometer. The mean Short's tonometer reading is 13.57. This study observed that overall IOP as measured by NCT was significantly higher than Goldmann applanation tonometer. P is equal to 0.004. However, the accuracy of non-contact tonometer was poor when the CCT was greater than 600 micrometer. Discussion. The NCT and GAT measurement showed good agreement, providing that both are reliable method of measuring IOP. At low IOP, less than 20 millimeters of mercury, GAT measurements are higher than NCT, and this relationship is reversed at higher IOPs. This suggests that the NCT tends to underestimate IOP compared to GAT in lower range and overestimate it in higher ranges. Tono et al. Reported GAT to be greater than NCT. Francis et al. And Pache et al. Found that the difference between the two measurements was greatest in participants with thin corneas, gradually lessening as CCT increased. The mean pressure noted by Short's was 1 to 2 mm lower than the mean obtained by the Goldmann applanation tonometer, indicating that tonometer tend to read lower than the Goldmann tonometer. The non-contact tonometer has both higher specificity and high sensitivity. It is thus a good screening tool. It gains further credentials as it is easy to use without any observer bias as it records pressure automatically. Limitations of the study. The study can have more cases if the study was of a longer duration. Hence, to conclude, this study aims to compare all three measurements of tonometers, that is non-contact tonometer, Short's tonometer, and Goldmann tonometer, which is the gold standard. In our study, we found that the intraocular pressure measured by non-contact tonometer was consistently higher than Goldman ablation tonometer. There was a tendency for NCT to underestimate IOP at lower ranges and overestimate IOP at higher ranges. By applying appropriate correction factor for central corneal thickness, it was hence found that non-contact tonometry could be used as a good screening tool for glaucoma evaluation. These are my references.